Over 34 million people in the United States and over 460 million people in the world are estimated to have diabetes, and many don't even know it. Are you one of those? In this video, we're going to help you recognize some of the obvious as well as some of the not so obvious symptoms that could point to you having diabetes. So keep watching to find out what they are. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. If you think this would be something that is helpful to you, make sure you subscribe, hit that notification button, and follow along with us. So as I said in my intro, diabetes is a huge problem throughout the world, and one of the biggest issues is that it goes undiagnosed until it starts causing damage to your body. Learning to recognize the symptoms are key to being able to get into your doctor before it's too late. Now, when we talk about symptoms of diabetes, though, it's important to remind you about the different kinds of diabetes that are out there. For simplicity's sake, we're going to talk most about the two types of diabetes, type 1 and type 2. There are some hybrid forms of diabetes that combines features of both, but that's beyond the scope of our discussion here. In type 1, in general, refers to the kind of diabetes where your body isn't producing a sufficient amount of insulin to function properly. Insulin is a hormone that signals the cells in your body to take sugar from the blood in order to use it for energy. When your body doesn't produce enough insulin, then you aren't able to use sugar. Type 2 in general refers to people who produce insulin, but they have a hard time using it right. We refer to it as insulin resistance. Insulin's there, but it just doesn't have the ability to function properly. As I mentioned before, there are some in-between cases where you have some of both features, but for simplicity's sake, we'll just keep with the type 1 and 2 distinctions. Understanding the difference can be important because when it comes to symptoms, one tends to be a lot more obvious than the other. Most of the main symptoms of diabetes can be shared between the two types. When you have very high blood sugars, it tends to overwhelm the ability of the body to retain sugar, so it starts to spill over in the urine. This then causes the most common symptom you may hear about, and that's having to go pee all the time. Because you're peeing all the time, you start to get dehydrated. So to compensate, you're getting more thirsty, you have to drink a lot more water. So the top two symptoms are just that, an increased frequency of urination as well as increased thirst. Along with that, you can get a really dry mouth feeling. You can start having unexplained weight loss as well. Now the reason this happens is that your body needs the insulin to be able to use sugar to give yourself fuel to run. When that's not working, your body starts to use a different kind of metabolism and will start breaking down muscle and other tissues to make the fuel that it needs. Now this is not a good way to go about weight loss. But you can also start to notice some blurry vision. Now this happens because high sugar starts to permeate in the fluid that's in your eye and change the consistency of it, making it harder to see through it. Other symptoms you can notice are extreme hunger, fatigue, irritability, slow healing sores, and frequent infections such as in the gums, skin, and yeast infections. So in both types of diabetes you can get all of these symptoms. The biggest difference though is usually in type 1 diabetes the symptoms tend to come on fairly rapidly. Most people are in general good health, but then over a few weeks they start to notice the thirst and increased urination and the hunger. The nausea and vomiting can start to happen, and you may even notice a fruity type smell in your breath. When this comes on rapidly, it can be a very dangerous thing. When you don't have any insulin, your sugars get very high, and your body tries to compensate to create energy through other means, and this produces something called ketones. These ketones change the pH or acidity of your blood, which does not allow your body to function properly. This can be a significant medical emergency and fatal if not treated quickly. So if you or a family member start to exhibit these symptoms, and especially if they're getting worse, you need to be seen right away. It really can be a life or death moment. You need to be treated with insulin and get it quick. Now when it comes to type 2 diabetes though, it tends to present a lot different. You can still have all the symptoms that we have described, but in the vast majority of the time you don't. The main reason is this, that type 2 diabetes is a lot slower in how it comes on. Type 1 diabetes can come on in a matter of weeks. For type 2, it can take years. But there's a difference in what's going on. Because you still produce insulin, you don't tend to get the dangerous condition of ketoacidosis. You can get very high sugar, so it still can be dangerous, but it tends to not be the acutely life-threatening event that happens when you don't have insulin. Because of this, symptoms tend to be a lot more subtle. You can have increased thirst and frequency, but since it was so gradual on how it came on, you may not even notice it. You may notice some vision changes, the slow healing, the frequent infections, but overall, most people, when they come in, are diagnosed because we just did some blood work and found it before it started with symptoms. Honestly, the most common symptoms we notice with type 2 diabetes comes from those who have not come in and had any routine blood work done and have been diabetic for years without anybody knowing. Because of that, when they start having symptoms that they notice, it's usually because the diabetes has started to cause damage to the body. When this happens, people usually start to notice changes maybe in their extremities. They can get some numbness or tingling, or even severe burning sensation in their feet. A lot of the times people have trouble at night and can't stand to even have covers on their feet because it hurts so much. Other effects that we may see are related to other damaging effects that happen with diabetes. You can see heart disease, strokes, and damage to your kidneys. Now, these aren't things that you'll usually notice yourself, but once they happen, we often find out that diabetes was the cause. There are some lesser known signs that we can see as well. In some, because the high levels of insulin in the blood, it causes skin cells to reproduce faster. Because of that, you can notice some dark patches of skin around where there's creases. We see them in the neck, but also you can see it in the groin and the armpits. You get a darker and thicker appearance in the skin. Now we call this ACANTHOSIS nigricans. Another one that you may not think about is erectile dysfunction. High blood sugar can damage the nerves and blood vessels, making it more difficult in this important part of your life. All of these symptoms are evidence that diabetes has already caused damage to your body. This is why it's so important that you get regular checkups to find things like diabetes before they can cause damage. Diabetes is a huge problem here in the United States and throughout the world. In the case of type 1 diabetes, there isn't much you can do to prevent it. So, being very observant and watching for more concerning symptoms is really important. In the case of type 2 diabetes, we can most times prevent it with proper diet and exercise. But still knowing the signs and symptoms to watch out for are vitally important to prevent the more significant issues that comes with diabetes. If you think you're experiencing any of these symptoms, please go in and see your doctor. Well, I hope you found this to be helpful. If you did, please take time to give this video a like and share it with your friends. It helps our channel to grow and reach other people that may need this in their life. Now, if you haven't done so yet, don't leave without subscribing and hitting that notification button so you don't miss out on any of our future content. But until next time, this is Family Med with Dr. Richardson, and remember, take care of your body because it's the only one you have.